There are multiple tests that can be done for screening for colon cancer, and I will go through each one of them. Certainly the most common one that is used for many years is actually checking the stools for occult blood. And what one does is get a sample of stool, and then one drops a substance on it and checks the stools to see if there is blood. If blood is present, one should then have further testing done with either a colonoscopy or a lower GI. Another potential screening test is having a lower GI, in which one has what's called a barium enema, where there's a substance that is infused through the rectum or into the colon, and one looks for abnormalities of the colon with the barium present within the colon. Other tests that can be done would be what's called a sigmoidoscopy, where one looks at the sigmoid and rectum with a small scope. One needs to have a prep for this, where the bowel is emptied the night before by using enemas or that of oral medications to clean out the bowel. The ultimate test, and I think the one that is used is I think the gold standard, is what's called a colonoscopy. For that, one needs to have the bowel cleaned out by oral medication the night before. One usually has to have nothing by mouth the night before, and liquids the day before. And what one does then is they have what's called a flexible colonoscopy, or colon test, in which they take a tube going through the rectum, sigmoid colon, up through the what's called the descending colon, to the transverse colon, and to the ascending colon, where one can look at every aspect of the colon to see if there's any polyps, growths, ulcerations, or any abnormalities. Certainly that is the gold standard for a screening test. There are going to be some future tests which I think will be are very promising at the present time. In the future, one may be able to look at the stool and do DNA testing, or look at the genes in the stool and see if one potentially has a colon lesion. And there's going to be some blood tests that will be developed that may do very well at screening as well. However, at the present time, the only way to screen the colon is either having a direct look at the colon or checking the stool for blood.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.